This is One-on-One. Dr. Maryjoan Ladden is Senior Program Officer of the Robert Wood Johnson Foundation. Good to see you.
Nice to be here.
We've talked to many of your colleagues over the past couple of years about the New Jersey Nursing Initiative that the foundation is really leading up. Extremely important. Remind folks, what is it and why is it so important?
Sure. Well, Steve, we're very committed to New Jersey. New Jersey's our home state, so we're very committed to nursing in New Jersey, but also to improving health and healthcare in New Jersey. So our initiatives in New Jersey around nursing are the New Jersey Nursing Initiative to improve the amount of faculty in New Jersey, so that our tagline is that so a nurse will be there for you. So as New Jersey residents get older and have more chronic illnesses and need more access to care through the Affordable Care Act, that there is a nurse there for you.
There is not right now, Doctor, a nursing shortage per se, but the nursing faculty issue is a different issue, right?
It is a different issue. So right now, at this moment, there are parts of the United States where there are shortages of nurses. There isn't a shortage of nurses in New Jersey at this moment. But as many nurses leave the workforce, the average age of nurses in New Jersey and other places is about 55 at this point, and the average age of nurse faculty is about the same. So as the economy gets better and more nurses leave the workforce, the Department of Labor projects that there'll be a huge shortage, probably 1.3 million nurses shortage in the United States, and about 40,000 nursing shortage in New Jersey. In order to produce more nurses, we need teachers. So we need faculty to produce more nurses in New Jersey and in the United States.
I know there's no one reason. There are multiple reasons for this. But what are the reasons why it continues to be so difficult? And right now, the nursing initiative that the Robert Wood Johnson Foundation is heading up will produce 61 new nursing faculty members, correct?
That's right.
But the question remains, why is it so hard? What are the reasons why it is so difficult to attract and retain nursing faculty members?
Well, if you think about people who go into nursing, they go in to care for patients and families and to make a difference in the lives of patients and families. And I don't think many people go into nursing wanting to be a teacher.
Right.
It is something that you want to give back over time, and you realize that you have wisdom and experience and you gain more education. But nurse faculty, by and large, are paid substantially less than nurses in clinical and administrative roles.
Is it $40,000 less?
Sometimes up to $40,000 less.
Why is that? If it's so important to have faculty members playing that extremely important role, why would nursing schools pay that much less?
Well, schools are bound very much by union rules. Many schools are unionized. State universities and others are unionized. If you look, though, at the faculty across the U.S. in terms of business, law, and engineering, and nursing, many universities have adjusted market rates upward for engineering, law, and business because they realize that people can earn much more money in the market than they would. But nursing has not had that bump in salary. So from your lips to God's ears.
Short-sighted?
Yes.
Not getting it, not understanding the implications of that. So listen, people make decisions for all kinds of reasons, but the economic piece of it clearly is a barrier.
Absolutely.
Any others?
Certainly it's economics, but it's also the lack of nurses with higher degrees, so with doctoral degrees. So the majority of faculty in universities require a doctoral degree or a master's degree. And the majority of nurses in the U.S. are prepared at an associate or a baccalaureate level. Only about 50% of nurses in the U.S. have a baccalaureate level. You have to have that degree to be able to move up to a master's and a PhD to be nurse faculty.
As national healthcare landscape changes, as January 2014 gets closer, and things are changing in preparation for that, and the Affordable Care Act becomes a reality, the shift in focus from healthcare, from hospitals, which will always be there, but more and more healthcare delivered in communities. What impact will this have, Doctor, on the need for nurses in communities, and what impact will that have on this discussion?
Well, I think most people know nurses because of hospitals, because of their work in hospitals, and they see them when they're sick and they're at their most vulnerable. But nurses and nurse practitioners like myself who are in the community providing primary care we're going to need many more of them as more 32 million Americans come in to access to health insurance and need access to care. We're going to need a lot more nurses and a lot more nurses trained as nurse practitioners.
Excuse me, there is in fact a primary care physician shortage.
Absolutely.
Tied to this.
Absolutely. There's a primary care physician shortage, and many primary care physicians don't practice in rural areas. They practice in more urban areas. And in New Jersey in particular, we really need nurse practitioners, we need physician assistants, and we need physicians to solve the primary care issues.
The Robert Wood Johnson Foundation has been at this for a long time. Who are your other partners? Who else is in this game with a vested interest?
Well, if you think about our New Jersey Nursing Initiative that we mentioned earlier, that's going to provide 61 new faculty. Our program office is the New Jersey Chamber of Commerce Foundation, and we feel very strongly that we can't be in it alone as a philanthropy, but nurses can't be in it alone. We really need many other partners. So the Chamber of Commerce Foundation here in New Jersey has been a great support for us. We also have another initiative in New Jersey, Transforming Care at the Bedside, and that's at the New Jersey Hospital Association.
We work with the New Jersey Nurses Association. Mm-hmm. They're a big part of this too, right?
They are. Certainly the action coalitions affiliated with the Future of Nursing report, which was an IOM report in 2010, 2011. The New Jersey Nurses Association, the American Nurses Association, and many of the state nurses associations have been key partners.
And J&J has had a very active campaign out there for a long time.
J&J has been wonderful. Certainly, I mean, General Robert Wood Johnson, who's our founder, was one of the founders of Johnson & Johnson. And Johnson & Johnson has a very active campaign for nursing.
Many years.
Absolutely, and they've been a wonderful partner for us in this.
Well, I just want to say that I often say full disclosure, but folks who know us know that much of our programming, healthcare programming, is in fact underwritten in part by the Robert Wood Johnson Foundation. And I said this before we got on the air, I'll also say it to you. We like doing medical and health-related programming, but it's hard to find folks who have the dollars and the commitment to do it. So thank you for allowing us to do this programming.
Thank you for doing it.
Well, we'll continue to do it because the need exists. Dr. Maryjoan Ladden is a senior program officer of the Robert Wood Johnson Foundation. I want to thank you for joining us. The need for nurse faculty continues, and there may be a nursing shortage down the road as things change and evolve. One-on-One will continue right after this. Stay with us.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Robert Wood Johnson Foundation, Robert Wood Johnson University Hospital, the heart of academic medicine, Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years, the Russell Berry Foundation, Fedway Associates, Inc., PSE&G, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship, and by the law firm of Gibbons PC. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey, and by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.